Hey everyone, thanks for joining. Today we're here with Dr. Ian Rabb, the new Chief Clinics Officer for Universal Ibogaine, TSXV IBO. Ian's one of the most recognized and respected leaders in addiction treatment in Canada today. He's a certified interventionalist and addiction specialist who has helped thousands of people overcome addiction. Ian, welcome.
Thanks so much. Pleasure to be here.
Absolutely, and a pleasure for us to have you here today. Listen, I want to dig a little bit into your background, because it's honestly, it's fascinating for us. You know, you're a doctor of optometry, highly educated, and had a storied career. But of course, I want to go back to the beginning. You know, you've talked a little bit about in your past interviews your struggles with addiction, you know, so which included some arrests, homelessness, and participant in organized crime. Would love to hear, you know, a little bit of your story and how you got from them to here today.
Well, it's been a long journey, that's for sure. Just first and foremost, I think it's really important to understand that I grew up in an upper middle class family, pretty normal white picket fence, older brother, older sister. You know, if you looked in from the outside, you would have never thought there would be someone that could have turned to addiction. My understanding of addiction, and I think it's really important before I get into that long history, that drug and alcohol addiction has nothing to do with drugs and alcohol. And most people that I've helped in the 20 years that I've been clean and sober and doing this work, all kind of have the same internal mechanism. You know, it's a physical, emotional, psychological, and spiritual problem that really has kind of a spiritual answer, and I don't mean religious answer. So I can go back into my childhood at a very young age, and I felt very disconnected, not a part of, separate from, almost adopted in a perfectly normal family. And that's really what happens when people become addicted. The drugs and alcohol stop all those feelings, and ultimately you start feeling connected. So I think it's really important to understand how addiction works before I talk about a little bit what happened to me.
Right.
So I was a highly motivated kid, like you said, educated. I have 4 university degrees. My addiction probably looked like accomplishments in the early years. I was kind of addicted to praise and getting accolades for all of the number of things that I did, and ultimately, as I started moving forward in my life and getting older, I turned to drugs and alcohol. My my um, my entrance into that world was not like one of these big entrances. I wasn't a 13-year-old kid getting high. I wasn't a 16 or 18-year-old getting high every day. It started on the weekends, and I'm a believer that the pot bone's connected to the coke bone, which is connected to the meth bone, et cetera, et cetera. So ultimately, you just transfer your addictions as you start getting addicted, and that happens with a lot of people. And today, in our world, we see a lot of people that have many addictions. It's not just one substance they're addicted to. In the past, you'd see people kind of addicted to one thing and stick to that one thing. So it's gotten very complex, and of course, mental health plays a huge role in that as well. So I, grew up in this upper middle class family, kind of normal, educated. Our parents really pushed education on all of us, and all 3 of us became very educated and quite accomplished in our younger years. When I moved I moved away. I moved away at a young age. First, I lived in Israel for a year, and then I started my university education at the University of Waterloo, and ultimately started dabbling a little bit more with alcohol and drugs, where I never drank to just feel a buzz. I drank to black out. I always wanted more of everything, and ultimately I could start seeing patterns of things going wrong in my life that I wasn't able to really put together with addiction. I just thought that I was given a bad rap, that things were just not working out for me. At a later in my life, I was diagnosed with ADHD, which ultimately, we know today that a lot of kids with ADHD end up in trouble with drugs.
Right.
So like I said, I was just a pretty normal kid. Played hockey, played sports, was popular, but on the inside, I was dying. There was just something wrong, and ultimately that drove me to drugs and alcohol to feel better about myself. Alcoholics and addicts have huge egos and no self-esteem, so there's always this huge separation between how you live and how you feel, and that was very evident in my life for most of my life. when I moved to Chicago to do optometry, in those years, I got more involved with substances that were much more addictive, using them first, weekly, and then ultimately, in the end, I became a daily crystal meth addict, and I used crystal meth for about 13 years. Whether it was solving my addiction problem or that problem of feeling consciously separated or disconnected from people, or it was solving my ADHD problem in the beginning, we don't know because the drugs for ADHD are very similar to crystal meth. But
Right.
crystal meth was my go-to, um, and I used every other drug in between. Absolutely everything. There's nothing I didn't use. I was very entrepreneurial as a kid, starting up lots of little businesses and lots of little stuff, and I that entrepreneurial spirit brought me also to some crime, and which I got in trouble for. Never convicted, just arrested. Never lost my license to practice. Was still, kind of. I was unscathed by the arrest, probably, which is why I didn't quit using for a long time. And
Right.
ultimately, after the arrest there was an intervention by my family. My dad and my sister intervened, and I went to treatment and got clean and stayed clean. And I've stayed clean on conventional treatments. I went to conventional treatment. I continued with 12-step. I've done some other work since then, in nouveau therapies and other areas where we can really work on bettering ourselves. But I've stayed clean and sober, and then I got really involved in the addictions community. First, about 15 years ago, I started a charity which houses 31 people post treatment. We know that the longer you can keep people involved in the treatment process, the better chance of success. So we've had about 83% success rates of keeping people for a year to 18 months in sober living or transitional living with supports. So that was my first endeavor into this, and then I participated on probably every board of directors of all of the public system. I got really engaged in understanding addiction, in understanding how government works around addiction. I ran in politics at one point, trying to get on the inside to change the thinking around addiction, because what we've learned over the last 50 years, although we have modernized treatment and found nouveau treatments and new treatments, the success rates of people coming out of treatment are still quite low. And so, one of my interests around Ibogaine and universal Ibogaine and psychedelics and plant medicine and stuff that's coming of age today was the fact that I think that we can make a dent, a huge dent, and completely transform addiction treatment with the use of some of these other plant-based medicine, other drugs that are now rearing their head in our world.
Right. So, I mean, obviously, addiction clearly shaped the path of your life to what you do today, no question. But why devote the rest of your life to it? What was that driving force?
So I'm gonna cry. Sorry, I get really emotional when I talk about this stuff. Um, I saw what it did to my family and what it did to me. I know how I suffered as a young man and a young boy prior to finding the substances I used. The substances I used kept me alive. I know that doesn't
Right.
make sense, but if not, I probably would have killed myself. I know the pain that other families feel from their loved ones facing alcoholism and addiction, and I learned an answer. I finally realized what was wrong with me from the time I was a little kid, and I had an answer for that and solved that problem. And so being able to share that with, first of all, one person at a time, ultimately um, uh, in Manitoba, where I grew up, and other provinces close by in the Western Canadian provinces. Over the last couple of years, I've really kind of got myself involved nationally and internationally, and just want to help people and want to help families and reunite families. Addiction is devastating.
Right.
This last year during COVID, I buried 81 people that I've worked with, them or their families, which is about 7 times more in a year than I've ever had to bury. Um, And I just have this passion and discipline and need to help people with addiction and help families find the right answer. You know, addiction is, I mean, it's a fatal progressive disease, and it affects the whole family. I don't, I, you know, I, there's not one family. I always say if you look at every family tree, at least one of us falls out. There's not one family that is not affected somewhere by mental health and addiction. And I felt that if I had an answer, I had to share that answer with, well, now the world, but prior to that, with anybody that would listen, who I could help and help their families. Families get really sick around this stuff. It's not just the identified subject or the addicted person.
Right.
It creates the dis-ease in the whole family, and reuniting those families is really one of my passions.
No, very interesting. And I mean, you founded 210 Recovery and Destiny House, Winnipeg's only sober living housing organization. You've been on the boards of numerous organizations and worked for many treatment centers. Hearing the story, it's absolutely fascinating. What accomplishment from your evolution from being an addict yourself to now working in addiction. What accomplishment are you most proud of? You'd say up to this point in your career.
Well, interestingly, to me, staying so clean and sober is the biggest accomplishment of all.
Right.
It's a challenge, a daily challenge, and helping people recover is a huge accomplishment for me. Starting Aurora Recovery Center was an accomplishment after doing 210. That was a 70-bed center with a detox. It was a huge accomplishment for me to join Edgewood Health Network over the last year and a half, working as their director of business development. Part of my role in business development was not only reaching out to families, but having the ability to reach out to corporations and unions and other types of organizations that have addicted employees, and try and kind of share the message with broader amounts of people. Because when you get into corporations, if you get into a big corporation, I won't mention one, but you get into one and you get them engaged in a conversation about mental health and addiction, that organization has the ability to help thousands of people that work for them. So ultimately, that was a huge accomplishment, and my biggest accomplishment will be when we get Ibogaine legal through Health Canada in Canada, and we start treating people with it. I think that will be my biggest accomplishment to date, and I look forward to being part of this process and developing clinics that maybe start stepping outside the box and start increasing our chances of success for people with addictions.
So that's a perfect segue, taking us to Universal Ibogaine now. Obviously, you've just recently joined. What was it about the company, that interested you, that you thought you could make more of a difference with them than somewhere else?
So interestingly, I was advising to the board of Ibogaine for the last 3 years prior to joining. That ended a few months ago, and then they started talking to me about potentially working for them. Ibogaine itself, Iboga, the African root that is a plant-based medicine that we're trying to now medicalize, has the potential to transform this world when it comes to addiction. And we don't have to look very far, whether it be in Canada, United States, or anywhere in the world, to see that especially the opiate crisis, but I call it the illicit drug crisis, or really a mental health crisis, has really taken over. And I think post-COVID, we're going to see it increase tenfold. So I see this as a segue into, first of all, creating nouveau treatments, looking at really what's worked and what's not worked in other centers, since I've been involved in a lot, becoming very evidence-based, yet kind of stepping outside the box and looking what's available today to hopefully increase our chances of success with patients or clients or members that are still sick. And Ibogaine has the potential, as I said, to really transform this world. It's different. It's the granddaddy of psychotropics, or psychedelics, as we talk about them. Sure. And what it does medically to the brain, and gives people the opportunity to really recover, is really mind-boggling to me. I'm shocked that it hasn't been approved for use yet in more countries. It has the potential of really restarting the brain pre-addiction. Now, I'm not talking pre-trauma, pre-bad behavior, pre-selfishness. I mean, the core issues that an addict has will still be their core issues. But one of the biggest obstacles in addiction is that brain chemistry takes a really long time to redevelop. So a meth user like me, it took 2 years or 3 years of being flat and depressed in early recovery to actually be able to get stable enough to start making moves and get healthier in mind, body, and soul. And Ibogaine has that ability in an hour and a half or 2 hours or 3 days to really bring someone to a place where they're ready to move and change and transform their life. And that's really, it's going to be a miracle. It will be a miracle when we start being able to use it. We've seen it used elsewhere in the world with great success as for detoxification. I look at it as a great agent for detoxification, especially with opiate addicts. I mean, it works for everything but benzodiazepines. But opiate addicts who have a really hard time getting clean and sober because of the pain they're in when they're in withdrawal, Ibogaine removes that pain in a very short period of time. So it gives people a fighting chance on the other side. So I see its use with every drug, again, other than benzodiazepines. And I think that we can really make a mark and change the world with Ibogaine as a detox and pre-treatment substance.
And are there other, we'll call them nouveau drugs, that you guys are looking at as well, in addition to Ibogaine, in the interim before, those clinical trials can really see its course? Are you looking at other forms of treatment, especially at the Kelburn Center that you're going to be taking over? What's the goal there?
So Kelburn's an interesting location. First of all, it's a 45-acre piece of property with a beautiful home that will have 10 to 12 beds for treatment. I hope to implement both conventional treatment and nouveau treatment and meld them together to try and create a program that's different than anything that's out there and see if we can get greater success. There are other substances and plant-based medicine and drugs that are being used today and we're seeing great success in both mental health, PTSD, and addiction. So I hope to bring those in. And, very interestingly, I'm an abstinence junkie. Like I love. I think you can create that change in your life, that transformation, that spiritual change, just with like the modalities, like the 12-step programs and others. But they don't work for everybody. So we have to start looking at different stuff that can work for anybody. So individualized treatment at Kelburn really create some form of individualized treatment where we look at the individual and create protocols. So you're not going to be able to use psilocybin or ketamine or MDMA or any of the other substances that are now being looked at immediately upon entry after detox with people. But we are going to be able to create protocols and really reinvent the wheel. And in those protocols, figure out which people are good or eligible for which treatments and bring them closer to the answer. And I hope to bring some indigenous ceremony to the program because I think that really works. There's so many things that I've seen work over the years that I think we need to implement and create something robust around all of those things, including the nouveau drugs and treatments that are out there.
Right. And so you'll be taking over the Kelburn Center. Obviously, that's day one, correct? That's okay. And so what's the time frame to really get that center up and running?
Well, the center's running now, not with the programs that I hope to implement.
Correct.
I hope to implement the programs by mid-January, early February. Okay. I hope in 2 or 3 months. I have to obviously I hit the ground running on Monday, 3 days from now. So I have to start looking, and I have people in mind, the right appropriate staff that have been trained in the use of psilocybin or ketamine or MDMA, even if they're not legal yet in Canada. Start developing further relationships with psychiatrists that are using some of these nouveau treatments, and start working with them to create a program that's ultimately inpatient. They're going to be in house for a considerable amount of time, and then how to implement those drugs and those practices with conventional treatment and mindfulness and EMDR and a bunch of other really trauma-informed, trauma-based treatments. We've seen that over the years that addiction is a trauma-based disease, and usually childhood trauma or incidental trauma. So we know, soldiers or firefighters or police and the incidental traumas they have in their life, or childhood trauma. In my case, I did have childhood trauma. I died at birth. I had surgery at 3 weeks old. My mother had terminal breast cancer from the time I was 4 to 8. Gladly, thank God she survived. But those things that happen in early childhood really affect the way we start living our lives, and those traumas actually have an effect on the addicted mind. And even generational trauma, really starting to look at, we know the effects of generational trauma from the Holocaust, from what's gone on in our indigenous communities. So trying to look at all of that stuff and bring something together so that we can, like I said, create a fulsome product that really can help people and save lives.
That's, obviously very fascinating, as I keep saying. And listen, it was a pleasure interviewing you today. We look forward to keeping in touch with you to see the progress out at Kelburn, as well as obviously your work to advance the Ibogaine trials in Canada. Ian, thanks so much for being with us today.
Thank you very much. I really appreciate the time.
Absolutely.